Hello and welcome to webinar series. So myself Shanti, and today's topic for discussion is all about urinary tract infections among women, and we are just going to discuss about its causes and preventions as well. For this, now I request our expertise, who is none other Dr. Gopichand Garu, who is our senior consultant urologist and laparoscopic laser and robotic surgeon, and very greatly to announce that he also deals with robotic urology as well. I mean, oncology urology as well. I welcome you, sir.
Hi, thank you very much, Shanti madam, for introducing me.
Yes.
Um, I have known Shanti for a very, very long time, highly dynamic, and she's a great educationist. And congratulations for this webinar.
Thank you, sir. And we are also privileged and honored to be associating with you for this session today.
Sure.
Yes, and I now request all these speakers to introduce one by one, and then we'll be going forward for the session. Yes, Shaila, over to you.
Thank you, ma'am. Hi, all. Good afternoon. I'm Shaila Dipti, working as a nursing officer at Amruta Sankalp Clinic. It's a holistic mental wellness center. I'm glad to be a part of this discussion today.
Yes, we do have a Sandhya from other side. Yes, Sandhya.
Very good afternoon, ma'am, and respected Dr. Gopichand sir, consultant urologist. And my name is Sandhya. I'm from Bangalore, working in Fortis Hospital as a staff nurse in oncology department. And thank you for giving me opportunity to as a speaker. I'm participating here for
Thank
providing
you.
me opportunity.
Yes, thank you. And we do have Shailaja from Eluru district, Andhra Pradesh. Yes, Shailaja.
Sir, hi sir, good afternoon. Myself Shailaja, as I'm working as staff nurse in Rockstar Hospital. And I thank you so much for giving me this opportunity, and I'm so glad to have in this meeting.
Yes. So great to hear about everybody's credential and working facility. So yes, we are going forward, sir. Yes, anytime, anything we wish to understand, we always start with a little, studies and prevalence about that particular condition. So my insight from your end would be, how common is this urinary tract infection among females, sir? Over to you, in short.
Is it for me?
Yes, sir. One by
Yeah,
one,
I
we'll
think
be
it is
for.
extremely common. When we talk of urinary tract infection,
Yes,
if we talk it generally, it is an extremely common disease.
yes,
In fact, I can say that um, somehow each and every female would at least get urinary tract infection once or twice in her lifetime. It is that common. So we don't need to panic about it, but then it is common. That's it.
yes.
Common and most of the time harmless also. Huh? So two things we have to remember, that is common and harmless also most of the time.
And is it in a bacterial infection in nature, like it affects right from kidneys, the bladder, or urethra, or the common the bacteria are Klebsiella, E. coli we get to see?
True. Most of the time, the organism that affects the bladder is the organism from the feces. E. coli is the commonest. So it is from
Yes,
our body that we are going to get this urinary tract. So we have to remember that is most of the time E. coli, sometimes Klebsiella. So it is like, the body, the organism is present in our body itself. It doesn't
yes,
come from outside. They are all, most of them are gram negative bacteria which are usually present. Nowadays, we are seeing some amount of viral cystitis also sometimes. So that is also very rarely that can also be causing urinary tract
yes,
infection. But most of the time it is the bacterial, and the organism is from our body.
yes. And it is all from gut bacteria as
It is
well,
from
right?
the gut
Yes,
bacteria. True,
intestine.
true,
Yes.
true, true.
Yeah, going forward, we like to hear from our speakers as well what they wish to understand from you. Yes, over to you, Shaila.
Sir, can you please draw us an insight on what are the types of UTI, sir? What are the differences, sir?
UTI is a urinary tract infection. So it depends upon what has it involved. So if
Yes,
it is involved the lower urinary tract, In lower urinary tract, unless it is very severe, we don't have to bother much. It is the involvement of the bladder and the urethra. So that is the lower urinary tract, and when it involves the kidneys or the ureter or the pelvic ileal system, it is an highly bothersome situation. So this you can divide the UTI into two, essentially two major parts. One is the lower urinary tract, one is the upper urinary tract. Lower urinary tract most of the time will not have fever, chills, rigor, all those things will not be present. But when it comes to upper urinary tract, you will have flank pain, chills, rigor, fever. It can go on to produce bacteremia, septicemia, to urosepsis. All those things are possible on the upper urinary tract infection. Lower urinary tract, till it is uh, to the bladder, we don't need to worry much. So we have to
Yes.
kill the urinary tract infection when it is at the bladder.
Yes. Very right insight you have provided. At least we could differentiate now ki what are the symptoms which could happen with the lower and upper tract infections. And I think it is very important for the nurses also just to interpret what kind of clinical scenario present patient comes with.
True.
Yes. Going forward again, we have yes, Sandhya, over to you. What are your insight? Yeah.
Yeah, so already you have clearly explained the signs and symptoms of lower respiratory, lower urinary tract infection and upper urinary tract infection. And is there any other common symptoms, signs and symptoms,
So
like for the
yeah.
Yes, sir.
burning, urination in burning and increased
Frequency,
frequency,
urgency.
and
Yes.
any strong urine smell, any pelvic pain? Like we can, in the starting stage of urinary tract infection, we can identify and treat that. Is there any
Yeah.
other signs and symptoms?
Yeah, Miss Sandhya, you have absolutely right points you have raised, and you have already told the symptoms. I will just repeat it. It is like number of times increases, frequency.
Okay.
When the person feels like passing urine, they have to go urgently to the washroom. That means they are not able to postpone urination. That is urgency.
Yeah.
Frequency, urgency, these are the two. Burning sensation and dysuria, these are the three things which are usually common. Added to that is nocturia, means getting up again and again for
The
urination
night.
at night. These are the three common symptoms. Sometimes pelvic pain, sometimes smell is also possible, but mainly the symptoms are burning sensation or dysuria. Number of times increases. When person feels like passing urine, cannot postpone it, urgency will be there, and night times increased urination. So these are the three symptoms that we have to look into it when we are dealing with the lower urinary tract infection.
Okay. This is
Yeah.
again with the
Thank you,
lower.
sir.
Yeah,
Yes.
yeah.
Yeah.
Thank
So,
you for the
yeah,
clarification.
Shailaja, over to you.
Sir, mostly which age group is more prone to have been UTIs and different causes, and how quickly can UTI spread, sir?
Again, spreading from one person to another person usually doesn't take place. So we have to
Yes.
be very clear on that, that UTI doesn't spread from one person. It is the gut bacteria which is responsible for it. When the bladder is not able to fight out the gut bacteria, some people get this urinary infection. So this is one thing. Second thing, sexually active age group is the common age group. Anything between 30, 40 is a common age group, that is the people have it. Again, there is the older age group again will have propensity to
Yes.
UTI, because the secretions and the fighting power, once menopause comes after some time, what happens? There is more amount of dryness in that area, and the immunity or the fighting power against these bacteria is not there. And again, at that time, patients again restart. It is again one more peak comes. So these are the two age group I think one should
Yes.
be really, think of when we think of age group where it is common.
Yes. Yes.
So that is
Yes.
important. Yeah.
Yeah, very rightly, as you said, yes,
Yeah.
even more than 65, and due to this, hormonal issues, menopausal women. So, what do we give them? Like, what type of treatment we should, or if they walk to your, OPD, let's say, sir, 70 or 65 above. So, what kind of treatment we should start with? Like, do we
There
give
we
them
will
some?
have to rule out why this is happening. And then
Yes,
most of the time we do an ultrasound, one
yes,
urine culture, and one routine examination, and simple antibiotics, empirical antibiotics is the thing that we start, and we should,
yes,
suppress the urinary tract. This is a common thing that is usually done in the OPD. And
yes,
if I say that what antibiotic I use, I most of the time, I use cefixime, although sometimes the guidelines don't tell about cefixime. That
yes,
cephalosporin, the last one I use most of the time, because I personally feel that these group of women of the older age group, cefixime has lesser side effects, but
yes,
otherwise Septron or Bactrim DS, that is sulfamethoxazole plus
yes,
trimethoprim, nitrofurantoins, and fluoroquinolones. Fluoroquinolones is levofloxacillin, ofloxacillin. These are
yes,
the antibiotics which are very helpful as an empirical treatment for UTI.
yes. And yes, Ashal,
Sir,
as we
like
were
I wish
discussing,
to
yeah.
know what is a red flag for UTI, sir? Like it's fever, chills, blood in urine.
Or
So
do they
you have,
also present mostly with the
Yeah.
flank pain and also like
Yes, sir.
when somebody should be very careful and they should just seek
you know,
doctors
yeah,
help?
perfect. Whatever the symptoms that you have, them absolutely you have nailed it, Shaila Deepti.
Thank you.
Fever. Fever means that it is not in lower urinary tract; it has gone to the upper urinary
Yes.
tract. Chills and rigor, flank pain,
Mm-hmm.
blood in urine.
Mm-hmm.
These are the lower one, burning micturition urgency may be a little, not very red. They may be called as a pink flag. Mainly red flag is fever, chills, rigor, severe flank pain, blood in urine. Apart from this, if the TLC count is on the higher side,
Yes.
most of the
Yes.
time, apart from symptoms, by the time they come to you as well, they will have one report of total leukocyte count and creatinine. I think one of these things, even if it is on the higher side, you should immediately push the person to secondary care immediately.
Yes. Yes.
That is
Yes.
what is. Uh,
Thank you, sir.
Yes. Fever, learning right from the first slide that majority of the UTIs are uncomplicated. Yes.
yeah.
So very, yeah. Sandhya, do you still wish to understand from sir? Yeah.
Yeah, like we wish to know that is there any difference between a complicated and uncomplicated UTI, sir?
Yeah, definitely. Uncomplicated UTI, most of the time it is bladder, no anatomical changes, simple
Yes.
antibiotics, the total count is normal, creatinine is normal, you know, patient
Yeah.
not having fever and all. It is just the lower urinary tract that we have been talking
Yeah.
about. When it comes to complicated UTI, the upper tract is getting involved. There is a secondary cause, maybe patient having another, something like catheter is there, or
Yes.
something like
Yeah.
another disease
Some secretions
associated
from the
with it,
catheter we can.
as another disease associated with it. It is the red flags. The complicated UTI is something like we have already seen in the red flag thing. So that is what is complicated UTI is all
Yeah.
about.
Yes.
Okay. Thank you for
So very,
clarification.
very rightly, as you said, and we get to see your prescription like as we receive the patient, and there is an order that complete urine examination, and as you said, as per the clinical picture, we got to send blood, sorry, the urine culture as well. So, do you wish to give few of your tips that yes, the nurses also should know how to interpret this UE report because a lot of the times we may file the report, we may not escalate the critical parameters to the doctor or to the team, and
Yeah.
then so yes, sir, what
Yes,
findings
Shanti.
like?
Yeah, Shanti, you
Yes,
are absolutely right. No, first of all, let us go to a urine routine examination.
yes,
Collection has to be perfect. So
yes,
we have to tell the patient for a right collection, clean the
yes,
private parts properly, and then collect the urine routine examination. Ask her to pass urine in that small collecting this thing, and
Midstream, yes.
midstream should be given. There
Midstream
should
urine.
not be
Yeah.
any contamination, of the
Yes.
hair or the areas. So that is very important. Contamination would mean that no analysis will not come correctly. Everybody
Yes.
will have some or other pus cells. Again,
Yes.
urine
Yes.
culture, same thing. A midstream, uncontaminated, clean that area. For adult, this is the absolute two correct method is midstream urine.
Yes.
Sometimes we in fact put a needle directly into the bladder and collect the urine also. Sometimes, not every time it is needed, but this is at least needed that the patient gives a midstream urine,
Yes.
and after cleaning that part.
Yeah.
But
In case of critical,
anytime they can give. It is not early in the morning or in the afternoon, nothing of that sort. Anytime they can give this urine. So that is important, except for if they are giving urine for tuberculosis. I think you'll have to give it early in the morning.
Yes.
Otherwise, anytime urination is, sufficient enough.
Yes.
Yeah.
Yes.
And
And mostly urine culture to be given before we, start the
start
antibiotic.
the antibiotics. Yeah.
that
Yes.
true,
Yeah.
absolutely
As yeah.
correct. That is also very important, that
Yes.
most of the
So
time we give
request
both
all the
the.
viewers to just have this cautionary measures, which is just spoken by sir, so that, there is no detection of error in CUE report.
Yeah.
Yes. Further going forward, yes, Sandhya,
Already, sir, you have told that most of the women will get the UTI in at least once in lifetime.
lifetime,
Is it a
yes.
fact or myth, sir?
It is a fact, I
It
think,
is a fact. Oh
what
my
I have
God. Then,
seen in my. But then that is just a plain, uncomplicated lower unit tract infection.
yes.
So,
Yeah.
which I think,
And touch wood, whoever are saved, they are saved. Because I myself, when I was preparing this content, I was
mm,
just thinking how safe I am. Because yes, we take all the precautionary measures. So that's how, yes.
we are
And
Yeah.
sir,
we are talking of lifetime here, and that to lower urinary tract infection. So, uh, let us, not even if it comes,
contrary.
it is not a very
Yes.
big problem. Yeah.
Yes, yes, yeah. So, sir, so I just wanted to again going forward, we see this, bottle everywhere, in every house.
Citralka.
This is
Yeah.
the citralka, the urinary alkalizer. Maybe I see even my neighbor who is 62 almost. She anytime if I just check also, how are you, aunt? Then she says, yeah, I'm very bad with burning micturations and all. So, auntie, आप citralka, are you taking? Yes, yes, I'm taking that. And we see husband going keep going and gets a lot of bottles so the role of urinary alkalizers, it is to minimize the acidic nature of the urine, and thus it also prevents stone formation, sir.
Yeah. Yeah.
Because yes, so over to you, sir, for your this
It
very common
does, it,
insight
do-
we like to
it does
understand.
change the pH of urine. And when you change the pH of urine to alkaline, when we alkalize the urine, the formation of certain stones like calcium oxalate stones and all will be on the lower side.
Yes,
Uric acid stone will be on the lower side. So most of the time, this alkalization do help. In some conditions, it may not help, but most of the time, it does help.
it does.
Even the urine symptoms, when we convert the pH of the urine to alkalize the urine about say around 7.5 and all, it does give some amount of relief to the patient.
Yes, yeah.
So I also do, prescribe a lot of, not citralca, but I do prescribe a lot of potassium citrate,
Okay.
KB6 or portrait MB6, which includes potassium citrate and or magnesium citrate. Those things I also do prescribe in my practice.
Yes.
And
I do
I
have a
also,
doubt.
yeah.
Yes, Sandhya.
May- Yeah, I do have a doubt that Citralka will work for the catheter patient also, who has already catheter with and have patient have a burning sensation.
No, it may
But
not help in that
No.
situation, but some amount of alkalization may help in that situation also, sometimes. Yeah.
okay,
Yes,
thank you.
Shailaja. We will be, yeah, we are almost nearing to the slides. Yes.
So, what is the drug resistance of UTI and what is the faster way to cure UTI, sir? It's my first.
They should come and see Dr. Gopichand,
No,
then only
no,
they
no,
can.
no, not needed. We have already gone to that slide wherein you are
Yeah.
giving tags. See, once or twice in a year, female, that to active females, that age group, once or twice in a year, I think you can just give antibiotics that would suffice. Antibiotics like cefixime, taxim, or
Mhm.
ceftran, or Niftran. If the patient is getting relief with that and there are no symptoms, no fever, no chills, no red flag signs at all, and just simple antibiotics, 1 or 2 days, getting the relief, I think anybody is allowed to prescribe. So you don't have to worry too much about that prescription in this age group. I'm not picking up adults here or children here. I'm just
Yes.
picking up this age group. I'm not even picking up older females. I'm just picking up, around 25 to 40. So you can just give 1 or 2 doses of Taxim. And if it is helping her and no symptoms at all, you can just,
Yes.
help the
And
patient. Not a
yes.
problem. Yeah.
So, sir, as you see, you treat a lot of patients. Like, do we also see these condition among below 25 age or 18 to 25? Yes, school
Yeah,
going,
yeah, yeah.
adult.
Sometimes, yeah,
Yes,
definitely.
yes,
When there are
yes,
a
yes,
lot of patients, in fact, patients who come to places like mine in Yashoda Hospital, most of them are maybe, younger age group or older age
yes,
group. I see a lot of that group also because this is a tertiary care center
yes,
and patients who haven't had, relief from the antibiotics, and most of the UTI which come to us are complicated UTI. Many of
yes,
them are admitted in ICU, you must have seen.
yes, yes,
They get
yes,
fever, they get chills, rigor, there's severe hypotension, there
yes,
is pyelonephritis, and the kind of hypotension and pyelonephritis you see, patients succumb sometimes in a matter of 12 hours. So you must have seen
yes,
in your career
yes,
many a
yes,
times, we run for this patient, we start this patient on noradrenaline, dopamine, all sorts of
yes,
things, give fluids, take this patient for DJ stenting, get a CT scan, see pyelonephritis. So you
yes.
must have seen so many of
So
them in
many,
your
yes, yes,
career, even at your places. So
yes,
sometimes, the kind of UTI that we get, the really sick patients,
yes,
you TLC count with 13 or 14,000, creatinine just shoots up to 2. So there is a one spectrum is that, patients indolent, nothing is going to happen kind of spectrum in UTI. The other spectrum is
Mhm.
to, in fact, I can say in my career and in your this thing also, you could have seen that it is
Yes,
sometimes more dangerous than malignancy.
yes,
Malignancy, at least it gives us some time. It gives you can operate them, you can give chemotherapy. It takes around a year, 2 years, 3 years for them to deteriorate. But when it comes to UTI, things happen so fast that sometimes you're not able to handle it, and
yes,
can't explain to the relatives also what is happening.
yes, yes,
Most of
yes.
them will not understand what is this. So this
Yeah,
is the kind of other extreme that we have seen. In fact,
yeah, yes.
yeah, today only we have 3 or 4 patients in the ICU, severe infection, severe and hypotension, urosepsis. Keeping
Neurosepsis,
them
yeah,
on, we're keeping them on
yeah,
NORAD and dopamine. We have done a CT scan. Patients has piles, little fat stranding. Fat stranding means some amount of infection in the kidney. We have to
yes.
rush the patient for DJ stenting. So both the spectrum are possible. Huh? I'm telling you in UTI. Yeah.
Yeah, the other day I have seen one lady, like a female patient, 29-year-old, only with a severe complex condition with the urosepsis and airway management also. We
Mm.
had to do tracheostomy and she was really going bad. But then because of the able expertise decision, the patient is getting better. So that's how, yes. And yeah, Shaila, this is we are just going to just wind up.
Yeah, so we
Yes,
clearly understand that sir has told about everything. And does the low water intake and dehydration causes so that the all females will neglect that they are dehydrated and not treated in
Yeah,
initial days,
it does
and
increase
it leads to the upper urinary
it
tract
does
infection. Is
increase
it
the
true, sir?
propensity. It does increase the propensity to get urinary tract infection, low water
Yeah,
intake, and postponing the urination for a very, very long time, and all those things does decrease the propensity, increase
that's
the
why the
propensity.
females
Yeah.
neglect in initial days,
True,
like
true.
so that it will lead suddenly to the upper urinary tract infection.
So yeah, so we were just, I was just going through the health website as you provided a lot of health talk on an academic update on the prostate health and all this. And I'm just glad to understand that you have also, tried to share the guide with us, like
Yeah,
UTI prevention guide. I'm going to share among everybody.
sure,
I
sure.
think we request all the viewers to just, prevent this, practical tips so that you don't get a UTI. Anything else you would like to understand? Matlab, you would like to just give the
Uh,
takeaway to the
let
nurses?
us come down to these practical tips.
Yes,
Very important, especially for females. I'm not putting up this for everybody.
yes,
Encourage oral fluid unless medically restricted. Very important slide. Unless medically restricted. So, educate. Taking a lot of fluids is not a mantra. Most of the time there is no problem, but in certain cases, especially with cardiac failure or renal failure, too much of fluid will be counterproductive. You may decrease your urinary tract infection, but patient might go into renal failure. Already patients who have renal failure or cardiac failure, those patients will have a lot of trouble. The second thing is very important: avoid holding the urine for a long time.
yeah,
It is for across everybody. Postponement of urine causes more problem than bad washroom, or the things from the washroom cannot come onto our body. So this is very
yes,
important that we don't need to postpone urination. So that is very important. This is also important during defecation. Cleaning up on all is to come from front to back. So this is where the gut microbes come. So hygiene is very important, and sexual intercourse and voiding after sexual intercourse is also a very important. The underwear thing, and I don't agree too much on that, but it's okay. But a very important that in postmenopausal women with recurrent UTI, some amount of vaginal estrogen is needed. But the thing is that when it is uncomplicated UTI, we don't need to wait for a long time. You can just simply start on some indolent antibiotic like Taximo or Niftran or some Bactrim DS
factory
as early as possible, so that we don't convert an uncomplicated UTI into a complicated
to
UTI.
the
Early
complaint.
disease,
Yes,
early pickup, and early hitting the patient with antibiotic is a good, mechanism
choice. Yeah,
to counteract the UTI.
yes. I I know this is very, very nice,
No,
interesting topic.
I
And
also very thankful to Shanti for having given me this opportunity. It's an excellent
thank you,
opportunity for me.
thank you, sir.
So I
And
think I'm ready to take any questions if somebody is asking
yeah,
me. Otherwise, I'm available at Yashoda Somachiguda
yes,
all
and
every day. And you have my website, that is drgopichandm.com. You can contact me on this website,
yes,
and my phone number is also available. Once
yes,
again, thank you, Shaila, Deepti,
Thank
Shanti,
you, sir.
Shaila, Sandhya, everybody, for
Thank
having
you,
given me
sir.
this
Thank
Thank you
you
so
so
thank
much.
much
you,
for
sir,
your
and thank you
valuable
so
time
much
and
for
interacting
this.
with us.
Thank you. Thank you.
Thank you,
It
sir,
was
and thank you
helpful
for
so
this
much.
guide.
Thank you. Thank you, ma'am.
Thank you for this guide as well. I've shared among our speakers, and we will be sharing with other
Sure.
nurses as well. Thank you, sir. Thank you for your
Yeah.
valuable time.
Thank
Thank
you.
you, Miss
We
Shanti,
end
for
the session.
gathering us together, and
Yeah.
it is a great time for us.
Thank you. Thank you.
Thank you, Shanti, ma'am. Thank you.